There is a vast amount of health-related information through research and experiments online to help strengthen communication between patients and their healthcare providers. In many cases, those diagnosed with a serious disease, such as cancer, are taken by surprise by this life-altering news.
Maybe a patient knows what cancer is, but has no knowledge about the type they have. Or maybe the patient has attained a misconception about their diagnosis due to a popular social perception within our society. Here we have Sally, whose symptoms presented as a case of mono. However, what was thought to be mono severely worsened, and she was admitted to the emergency room at a local small-town hospital. Once her results were read, the physician came in, held her hand, and said the scan showed tumors in her liver, lungs, and spine. He believed it was a rare type of cancer that he knew nothing about, and that she would need to be admitted to a larger hospital in a neighboring town for further tests.
After a week of tests, Sally is diagnosed with a rare cancer that sends her to a specialist at MD Anderson in Houston.
At her first visit to her oncologist, Sally was made to believe that her form of cancer was something that her prior doctor was being dramatic about. The oncologist made her feel as though she was insignificant in this large hospital of other patients with actual serious cancers. When he started her on medication in an attempt to shrink the tumors, she did not take the treatment plan seriously. She didn't see her diagnosis as important and didn't take the pills as prescribed. Her oncologist soon took her off the pills, frustrated with her lack of commitment to treating her disease.
47% of patients fail to comply with therapy because they are not convinced that they need it, according to data compiled by Wilson Health Information. Even if they agree that they need some intervention, they may nevertheless forget to fill their prescription. Or if they do fill their prescription, they may fail to take their medication as directed.
The National Council on Patient Information and Education reports that half of all patients forget verbal information communicated by their physicians, while almost two-thirds, 60%, are unable to report precisely what they were advised to do even 1 hour after leaving the doctor's office.
After 3 years of exams and tests, a clinical trial is suggested by her oncologist. The physician does not take the time to explain why this is necessary and what exactly the trial will entail. Instead, he sets up an appointment to discuss it further for 2 months later, after the drug has been approved. Sally is now left confused, scared, and without much information. Clinical trials have come to be regarded as the gold standard for treatment evaluation. However, many doctors and their patients experience difficulties when discussing trial participation, leading to poor accrual to trials and questionable quality of informed consent. Patients are hesitant to participate in clinical trials due to not knowing enough information. However, there are many online sources that they can take advantage of in order to educate themselves.
In Sally's case, because her condition was so rare, her physicians from her family doctor to her oncologist knew too little and didn't have much information to share with her during her visits. In order to take control of her own health, Sally resorted to using the internet as a source of health information. She began researching her disease and how a clinical trial can benefit her. New technologies available online have been developed to allow for improved communication between doctors and patients. Systems such as MyChart and iCare are interfaces developed that allow for direct lines of communication with their physicians. They also serve as sources for credible information so that patients may be better informed when making decisions concerning their health care.
There are also guides available online to help an individual, such as Sally, navigate through websites in regards to health information research.
Because she took the initiative to educate herself by using online resources, her understanding about her diagnosis had improved immensely, and Sally was now able to communicate more effectively with her doctor.
No one experience is the same for every person, just as no one person communicates in the same way. Throughout the years, methods to improve this relationship have been developed through training and expanding access online.
You may not consider communication between doctors and their patients an issue of great importance. That is, until you find yourself in Sally's shoes.